All right, let's begin. I want to test your knowledge. Can you name the special test being demonstrated in this video? The examiner will hold the MCP in max extension and passively flex the PIP, stretching the intrinsic muscles. Notice, is there a limitation in PIP flexion? Now, place the MCP in flexion to relax the intrinsics and flex the PIP. Again, note the difference in PIP flexion range of motion. You would repeat this for each finger that the exam is asking you to perform it on. All right, could you name that special test being demonstrated? The answer is the Bunner-Littler test. This test tests for tightness of the intrinsic hand muscles. If PIP flexion range increases when the MCP is flexed, the intrinsics are tight. If PIP flexion is still limited when the MCP is flexed, the issue is most likely PIP capsular tightness. And make sure you always know that the test is not valid if the MCP joint is subluxed or a swan neck deformity is present. All right, next up, which of the following shows the correct demonstration of the collateral ligament test? Option 1. Flex the MCP joint to 90 degrees to ensure the collateral ligaments are taut. Next, you will grasp the proximal phalange and gently apply pressure to radial and ulnar sides. Option 2. Maintain the MCP in a neutral position, 0 degrees of extension or flexion, to ensure the collateral ligaments are taut. Grasp the proximal phalange and gently apply pressure to the radial and ulnar sides. So, which one was correct? The answer is option 1. You want to flex the MCP joint to 90 degrees to ensure the collateral ligaments are taut. These collateral ligaments are the most taut at 90 degrees of flexion. A positive finding would present if there was excessive laxity, allowing movement to occur in the radial or ulnar direction. Last question. I'm going to show you a test and I want you to tell me about what the finding means. So, to perform the passive tenodesis boutonniere test, you will passively flex the wrist and MCP. You will look to see if the PIP extends. If the central PIP extends as the MCP flexes, option 1, the central slip is intact. Option 2, this indicates a possible central slip tear. The answer is option 1, the central slip is intact. If the PIP does not extend, this indicates a possible central slip tear. All right, hopefully you got those right. Comment below with how many you answered correctly. Thanks for joining me today.